And we want to take a closer look now at exactly who is eligible to receive this booster shot. Joining me live to break it all down is Dr. Saima Aslam, an infectious disease specialist at UC San Diego Health. We know this is a busy time, Dr. Aslam, so thank you for being here.
Thank you. It's a pleasure.
Can you walk us through then exactly so our viewers have clarity who is eligible to get this booster shot?
Yes. So the ACIP and CDC made guidelines based on FDA authorization. So these are people that are immunosuppressed. So this would include somebody that has an organ transplant and is taking medication. It includes people that have cancer, receiving chemotherapy. It includes people with bone marrow transplant, people with advanced or untreated HIV infection, and then a variety of medications that people can be on for example, lupus or rheumatoid arthritis that also cut down the immune system. So in general, we want to try and boost the antibody and T-cell response in people that have suboptimal response to 2 doses of vaccine.
Let me ask you this specifically about cancer before we talk about the timing of why this came out now, because a lot of people may have just finished their treatments for cancer or some other disease. Now, are they not eligible, or how does that work for recent cancer survivors who are done with treatment?
Right. So if somebody is done with treatment, and it again depends on the kind of treatment they received. Some patients may not be immunosuppressed to the same degree as the others that are on active chemo. So I think at least for people that have recently finished chemotherapy, they should reach out to their cancer doctors to understand if they qualify or not. But at the moment, this is really for people that are either moderately or what's called severely immunocompromised.
All right, so consult your oncologist.
I want to add one more. Definitely, yeah. One thing I do want to add, I think it's to know the third dose is not a panacea that prevents 100% COVID. Studies that were recently published, there's one from Canada published in New England just 2 days ago. In that study, organ transplant recipients received 3 doses of the Moderna vaccine, but even after 3 doses, a third of patients did not have a response. So, even for people that are getting their 3rd dose, we still need to be really careful with masking, social isolation, and, just being careful.
All right, so let's talk timing. Why did this approval come out now?
I think there've been recently, it's kind of a drumbeat of studies, at least within the transplant population, showing that antibody response is suboptimal. 2 days ago, a study, kind of a landmark study really, was published, a randomized controlled trial from Canada of organ transplant patients that received a 3rd dose versus placebo. And that's really the first sort of prospective randomized trial that showed that in people that had suboptimal response after 2 doses, we were able to increase that response after a 3rd dose. But again, that increase does not go to 100%. So having actual real data, I think, is what drove this change.
Well, it's just a matter of time, it sounds like, before we all need a booster shot. So how soon could it become widely available?
I think there's a lot. I cannot speak for the ACIP or CDC or any of other regulatory bodies. I think over time we probably will need more. I think it makes sense to really focus on the people that are very immunosuppressed or that we know have suboptimal responses. But perhaps over time, additional patient groups, for example, the elderly, or perhaps healthcare workers, et cetera, may come under this umbrella. But at the moment, this is the specific group we're targeting.
And doctor, I don't have to tell you cases and hospitalizations are on the rise. We just reported 1,700 new cases today alone. What is the most important thing our viewers should take away from this interview?
So I have a couple of points. One, get vaccinated. The majority of people that are admitted to the hospital with severe disease are unvaccinated. Second, if you do develop COVID, regardless of your vaccine status, immediately get in touch with a physician or other medical provider to get or ask for monoclonal antibodies. So in San Diego County, there are a number of clinics, including free clinics through San Diego County that actually provide monoclonal antibody. The key is to get it early to prevent disease progression and prevent hospitalization. And then even if even if you've had COVID, even if you've received the antibody or are vaccinated, we really, really need to wear masks when we're out and about. Delta is much more infectious than the previous variants. And so, all these studies we've done in the past with vaccinated people, some of that changes with Delta. We are seeing more breakthroughs with Delta. The good thing is the majority of these breakthroughs are mild. So I think things change. And so, someone may have promised a month or 2 months ago, oh, you don't need masks, the pandemic is over. But the virus is a whole lot smarter than that. And I think it behooves us to be careful, especially for people that we know cannot mount a good antibody response to the vaccine.
Well, clearly with 1,700 new cases now, that hasn't been that high since January. It's not over by a long shot. Dr. Saima Aslam, thank you so much for your time tonight and your expertise.
Thank you.